So now we're going to look at hormonal regulation in females. So what we found with males is testosterone shuts off its own production, and so then that means that testosterone levels stay roughly constant over time in males. Females, much more complicated, and the reason for this is because females have the job of carrying the baby. And so females have to constantly switch back and forth between two modes. Mode number one is just regular old female hanging out, chillaxing, doing whatever. But then all of a sudden, mode number two is prepare for pregnancy. And so we got to kind of shift back normal mode, pregnancy mode, normal mode, pregnancy mode, and kind of shifting back and forth between that. And then if she actually does get pregnant, then we have to shift to a totally different place to accommodate that. So females are sort of burdened with much more complex hormonal regulation systems. So let's dive in. It's very complicated. So here's just kind of a quick overview, and you can see there's 4 different hormones. There's something going on with this follicle that I had mentioned before and that cloud thing, the endometrium, that lining of the uterus. There's a lot happening, so let's break it down. So we're going to do a player's process. The first player is the follicle. I mentioned this briefly in the introduction to this unit, where we first learned about the egg, and the follicle are these support cells that surround the egg. Its job is to produce the hormones that we're about to discuss, and you can see that this follicle is actually growing in size over time. The second player are the hormones themselves, and there's 4 major ones involved. FSH stands for follicle stimulating hormone. This is actually the only example I can think of anywhere in anything where the name is actually based on its role in the female body and not male, like it's female centric, not male. So bask in the glory, ladies. So follicle stimulating hormone, FSH, is produced in the pituitary gland, and it causes the follicle to grow. So follicle stimulating hormone stimulates the follicle to grow. Makes sense. LH stands for luteinizing hormone, also produced in the pituitary gland. It causes the follicle to turn into the corpus luteum. Luteinizing hormone turns into the corpus luteum. Estrogen is produced by the follicle, those cells around the egg. Its main job is to thicken the lining of the uterus. I should also point out there are actually many types of estrogen. Estrogen is just kind of a catch-all category for several different hormones that have similar roles. And then progesterone is produced in the corpus luteum. Its job is to maintain that thick lining of the uterus. So again, hopefully this all makes sense when it comes together, but for now, here's the players. The third player is the uterus itself. So the uterus is home to the fetus, and that's where the baby develops. So that's going to play a role in all this as well. So what is the process? Well, first we have what's called the follicular phase. In the follicular phase, a hormone causes the follicle to grow. Take a look back at the table you just wrote down. What is that? What hormone is it? Did you say FSH? Because it's FSH. So FSH causes the follicle to grow, and we can see these reddish cells around the egg are getting larger, right? It's growing. We're getting more of these cells. Now, as the follicle grows, it's going to produce a hormone. So again, look at that table. Which hormone does the follicle produce? And hopefully you said estrogen. So estrogen levels, you can see, are rising as the follicle grows. And then estrogen causes the lining of the uterus to thicken. And lo and behold, after this estrogen levels rise, we see the uterus increase in size. So follicle produces estrogen. Estrogen causes the lining of the uterus to thicken. Now, why would this be happening? Well, the egg is inside this follicle. Soon we're going to release that egg, and that's when pregnancy can occur. And so by thickening the lining of the uterus, we're creating a little home for that embryo to implant and begin to develop. So we're adding cells, we're adding nutrients, we're adding blood vessels, we're adding everything that potential embryo is going to need. So the follicular phase is all about prepping the uterus to make sure it's a suitable habitat for that little fetus to develop. Okay, The next step then after the follicular phase is ovulation. Ovulation is the release of the egg from the ovary. So the egg is like kind of released. I don't know, it kind of looks like a little explosion kind of thing. Some of those follicle cells are still sticking out around the egg, still kind of stuck on there. That's that corona radiata we talked about. And so the egg is now going to be released. It's going to travel down the fallopian tube and await sperm cells to potentially fertilize it. And then we have the luteal phase. The luteal phase what happens here is that another hormone causes the follicle to turn into the corpus luteum. So look at that table, figure out which hormone it is. Hopefully you said LH. LH causes the follicle to turn into the corpus luteum. And so the corpus luteum, it looks like a cloud. And so these remaining follicle cells, they just kind of change what they're doing after ovulation, and they have this different appearance. And then you may recall the corpus luteum produces a different hormone, and hopefully you remember that as progesterone. And then progesterone's job is to maintain the lining of the uterus. So you can see that after ovulation, progesterone levels rise because this corpus luteum is producing it. And then its job is to keep that lining thick to make sure that it stays that way for the fetus. Okay, so this is basically the monthly cycle. So from day 1 to about day 28, this is what's going on in the female. And you can see their hormones are changing quite dramatically over the course of this cycle. So let's talk about a few things. You may have noticed that ovulation occurs around days 12 to 14. Can I casually use the timing of this cycle to avoid pregnancy? This, by the way, is called the rhythm method. So ovulation is happening here days 12 to 14. That's when the egg is released. So could I potentially use this knowledge to, avoid pregnancy? If you just avoid intercourse from days 12 to 14, does that mean that I will no longer have risk of pregnancy? The answer is no, with an asterisk. So what do I mean by that? Here's the problem. Here's why the rhythm method is risky. This graph is an average. So, if we graph the average height in the class, the average female in our class, I don't know, 5'4", 5'5", somewhere in there. But most women aren't 5'4" or 5'5". They're either taller or shorter. They average out. Same here. This is an average. So it may not be day 12 to 14 for any individual female. Second, a woman might vary from month to month. So, day 1 is marked with, that day 1 is kind of characterized by menstruation here, the end of menstruation. And so, some women are more regular than others in terms of when menstruation happens. And so, it may be day 12 one month, but maybe another month it's day 10, and then another month it's day 16. Like it can oscillate a little bit there. So that kind of widens the window a little bit of when that ovulation is going to happen. The other thing is sperm can live inside a female for 3 to 5 days. So maybe intercourse takes place on day 7. Day 7, really far away from ovulation. Should be okay. But then the sperm are inside that female body, they're at the end of their life cycle, they're gathered around the campfire, they're saying, guys, we did our best. We really gave it our all, but it just doesn't look like the egg is going to show up. And then all of a sudden, at the very end of their life cycle, off on the horizon, they see the egg rise up. There it is. And they're like, there, now's our chance. Go, men, and they can still manage to do that. So you can see how this widens the range even more. So, the rhythm method is risky. There is, a more careful way to do it where you get a highly sophisticated thermometer. You measure the female's body temperature every morning, like before she even moves, she has to measure her temperature. There's ways to track really carefully when ovulation is happening, but it's not something that's particularly safe in a casual way. It's something that, effort should be put into if that's the main method to avoid pregnancy. So the other thing about this is the birth control pill. The birth control pill actually contains hormones that alter the normal menstrual cycle. And notably, they prevent ovulation by preventing this little surge in LH. So you notice right at ovulation, there's what's called LH surge. And these hormones prevent that from happening. So without that surge in LH, ovulation doesn't happen, and so then there's no egg released. And if there's no egg released, then the female can't become pregnant. So birth control pills are actually quite effective. Um, there's different types. Some they're called multiphasic, and in these, every single pill is a little bit different, and so you have to take the pill in a proper order. So like the red one isn't the same as the green one. So you got to kind of go in order, and you're supposed to take them at the same time of day every day, to kind of really regulate the hormonal environment inside. Interestingly, there's 1 week that's like sugar pills where it's a placebo. You're not really getting any hormonal treatment, and that happens during menstruation to allow menstruation to happen. And so, females can either choose to take those sugar pills or just throw them in the garbage, but they're included as a placeholder so you don't lose track of your cycle. Other types, called monophasic, each pill has the same dose, so there's different ways of that. So basically, there's two outcomes of this menstrual cycle. Outcome number one is no pregnancy. If no pregnancy occurs, then what happens is this corpus luteum slowly disintegrates. As it disintegrates, progesterone levels drop. And without progesterone to maintain the lining of the uterus, it is shed. And all the cells and blood vessels and nutrients that were built up in preparation for pregnancy are released during menstruation. The other outcome, though, is pregnancy. And if pregnancy happens, another hormone comes into the mix. It's called human chorionic gonadotropin, or HCG, and this hormone is released by actually the developing placenta, and it maintains the lining of the uterus since progesterone levels are dropping. It's like this little distress call sent out by the developing placenta that says, "Hey, I'm out here," and that maintains this lining of the uterus to prevent menstruation from happening. Interestingly, HCG is what home pregnancy kits detect. So the HCG finds its way into the urine, and so home pregnancy test kit has a female basically urinate on this stick, and the HCG interacts with the chemical in here to light up a little line. So that's what those are measuring. So I'm going to pause it there, and in our final phase of this unit, we will look at pregnancy and birth and all the wonderful things that happen during that phase.